Today's discussion focuses on a critical topic for everyone over 60, protecting your brain from the risk of stroke. Many of you may have experienced moments in the morning, dizziness, weakness, or feeling slightly off that you dismissed as normal aging. Those moments are not always harmless. They could be your body's way of signaling a potential problem. Stroke often builds slowly through small, everyday habits that seem insignificant but can harm your brain over time. The good news is that simple changes to your morning routine can significantly reduce your risk. This presentation covers 7 common morning habits that may increase stroke risk in older adults and offers practical solutions to keep your brain healthy, your balance steady, and your independence intact.
Habit 1. Rushing out of bed too quickly. The first habit is one most people do without thinking, getting out of bed too quickly. After a night of sleep, your body is in a relaxed state. Your heart rate is slow, your blood pressure is low, and blood flow to your brain is reduced. When you jump out of bed and stand up abruptly, your blood pressure can drop suddenly, a condition known as orthostatic hypotension. This is common in older adults because aging blood vessels are less elastic, making it harder for your body to adjust quickly. Orthostatic hypotension reduces oxygen delivery to the brain, causing dizziness, lightheadedness, or even a brief feeling of fainting. These moments may seem minor, but they indicate your brain is not getting enough oxygen. Over time, repeated episodes can stress the delicate blood vessels in your brain, increasing the risk of a transient ischemic attack, or mini-stroke, or a full stroke. Studies suggest that orthostatic hypotension is linked to a 40% higher risk of stroke in older adults, particularly those with existing cardiovascular issues. Consider the case of Mary, a 68-year-old who loved starting her day early. She would leap out of bed to tend to her garden, but began noticing dizzy spells when standing up. Initially, she thought it was just fatigue. Over months, these episodes became more frequent, and one morning she experienced temporary weakness in her left arm. Tests revealed she was having TIAs, warning signs of a potential stroke. By changing her morning routine, she avoided a worse outcome. To prevent this risk, adopt a gentle wake-up routine that takes less than 2 minutes. When you wake up, take several slow, deep breaths to stimulate circulation. Stretch your fingers, toes, and arms to encourage blood flow. Sit up slowly on the edge of your bed and pause for 10 to 20 seconds. Place your feet flat on the floor, take another breath, and stand up gradually, holding on to a stable surface if needed. This approach allows your blood pressure to stabilize, ensuring your brain receives adequate oxygen. If you've ever felt unsteady or dizzy in the morning, this small adjustment can make a significant difference. It's not about moving slowly, it's about moving wisely to protect your brain for years to come. This habit is particularly important for those with high blood pressure, heart disease, or a history of dizziness. The brain relies on a steady supply of oxygen-rich blood, and sudden changes in posture can disrupt this balance. Research from the American Heart Association indicates that managing orthostatic hypotension can reduce stroke risk by up to 20% in at-risk populations. By taking a moment to wake up gently, you're giving your brain the care it deserves.
Habit 2. Skipping a glass of water in the morning. The second habit is skipping a glass of water first thing in the morning. After sleeping for 7 or 8 hours, your body is mildly dehydrated. You lose fluids through breathing, sweating, and metabolic processes, and you haven't consumed any liquids during that time. Dehydration thickens your blood, slows circulation, and increases blood pressure, all of which strain your brain. Since the brain is approximately 75% water, even mild dehydration can impair its function, leading to reduced alertness, slower reaction times, and a higher risk of stroke. For older adults, dehydration is a greater concern because the body's ability to regulate fluids declines with age. Many seniors also take medications like diuretics for blood pressure or heart conditions, which increase fluid loss overnight. Studies show that dehydration is associated with a 30% higher risk of stroke in older adults, particularly when combined with other risk factors like high blood pressure. Dehydration also affects memory and cognitive performance, which can mimic early signs of dementia, but are often reversible with proper hydration. John, a 72-year-old patient, experienced morning fogginess and difficulty concentrating. He loved his coffee and bagel routine, but didn't drink water until midday. After starting his day with a glass of room-temperature water, his mental clarity improved within weeks, and his headaches disappeared. This simple change helped his brain function better and reduced his stroke risk. For incorporating this habit, drink 1 full glass of room-temperature water as soon as you wake up, before coffee, tea, or medications. Room-temperature water is gentler on the stomach and encourages absorption. This practice thins your blood, improves oxygen delivery to the brain, and supports overall circulation. If plain water feels unappealing, add a slice of lemon, cucumber, or mint for flavor. Keep a glass by your bedside or set a reminder to make it part of your routine. This 1-minute habit can have a profound impact on your brain health. For those on diuretics or other medications, hydration is even more critical. Water helps your body process these drugs effectively, ensuring they protect your brain as intended. A study in the Journal of Stroke and Cerebrovascular Diseases found that adequate morning hydration reduced blood viscosity by 15%, lowering the risk of clot formation. By prioritizing water, you're giving your brain a daily boost.
Habit 3. Eating high-sodium breakfast foods. The third habit involves a part of the morning many look forward to, breakfast. Common breakfast foods like cereal, toast, sausages, or instant oatmeal packets often contain hidden sodium. Even items labeled healthy, such as whole-grain cereals or low-fat breakfast bars, can have high sodium levels. Sodium is a concern because it causes blood vessels to constrict and blood pressure to rise, especially in the morning when your body naturally experiences a blood pressure spike as it transitions from sleep to activity. For older adults, excessive sodium is particularly dangerous. Aging blood vessels are less flexible, and high sodium intake can stiffen them further, increasing pressure on the brain's delicate capillaries. This raises the risk of stroke, memory issues, and sudden dizziness. Research from the American Heart Association suggests that reducing sodium intake by 1,000 milligrams daily can lower stroke risk by 12% in people over 60. Many breakfast foods exceed the recommended 300 to 400 milligrams of sodium per meal, with some processed items containing 800 milligrams or more in a single serving. Susan, a 66-year-old, ate what she thought was a healthy breakfast, instant oatmeal with a flavor packet and turkey sausage. She began experiencing morning headaches and confusion. After checking her food labels, she discovered her breakfast contained over 800 milligrams of sodium. By switching to plain oatmeal with fresh berries and a boiled egg, she reduced her sodium intake significantly, and her symptoms improved. To make your breakfast brain-friendly, check food labels for sodium content and aim for less than 300 to 400 milligrams per meal. Replace instant oatmeal with plain oats, topped with fresh fruit, unsalted nuts, or a drizzle of honey. Swap processed meats like sausage for avocado or a boiled egg with a sprinkle of pepper. Use herbs or spices like cinnamon or basil to add flavor without sodium. These small changes can lower your sodium intake by hundreds of milligrams, easing the strain on your brain's delicate capillaries. Reading labels can be eye-opening. Many foods don't taste salty but are packed with sodium, such as store-bought breads or cereals. The National Institute on Aging recommends keeping daily sodium intake below 2,300 milligrams for older adults, with 1,500 milligrams being ideal for those with hypertension.
By starting your day with a low-sodium breakfast, you're taking a proactive step toward protecting your brain.
Habit 4. Drinking coffee on an empty stomach. The fourth habit is one many cherish: drinking coffee first thing in the morning, often on an empty stomach. Coffee is a staple for millions, but for those over 60, consuming it before eating can pose risks to brain health. Caffeine is a stimulant that increases adrenaline, accelerates heart rate, and causes blood vessels to constrict. When taken on an empty stomach, these effects are amplified, leading to a rapid spike in blood pressure. For older adults, whose arteries may be less flexible, this sudden spike can strain the brain's blood vessels, increasing the risk of mini strokes, irregular heart rhythms, or cognitive issues over time. A study in the Journal of Hypertension found that caffeine on an empty stomach can raise blood pressure by up to 10 millimeters of mercury in older adults, a significant jump for those with existing hypertension. Excessive coffee consumption, multiple cups in a row, can exacerbate these effects, and sugary creamers or syrups add inflammation, further stressing the cardiovascular system. Tom, a 70-year-old patient, drank 3 cups of coffee before breakfast each morning. He began experiencing heart palpitations and brief moments of confusion. By adjusting his routine to include water and a light breakfast before 1 moderate cup of coffee, his symptoms improved and he felt more energized throughout the day. To enjoy coffee safely, drink a glass of water first to rehydrate your body. Eat a light, brain-friendly breakfast, such as a boiled egg, fruit, or whole grain toast, to stabilize your blood pressure. Limit coffee to 1 8-ounce cup and avoid high-sugar creamers. If you rely on multiple cups to combat fatigue, it may indicate dehydration, poor sleep, or another issue that warrants a doctor's visit. Timing and moderation are key to making coffee part of a healthy routine. Coffee isn't the enemy. It has antioxidants that can benefit health when consumed wisely. The American College of Cardiology suggests that 1 to 2 cups daily may reduce stroke risk when paired with a balanced diet. By prioritizing hydration and food before coffee, you're protecting your brain from unnecessary strain.
Habit 5. Ignoring subtle morning symptoms. The fifth habit is ignoring subtle symptoms that occur in the morning, such as dizziness, weakness, numbness, or slurred speech. These signs are easy to dismiss as sleeping wrong or being tired, but they could indicate serious issues, including poor blood flow to the brain, sudden blood pressure changes, or a transient ischemic attack, a TIA. TIAs are brief episodes lasting a few minutes that mimic stroke symptoms but resolve quickly. They are critical warning signs, as up to 20% of people who experience a TIA have a major stroke within 3 months, according to the American Stroke Association. Linda, a 65-year-old, noticed occasional morning dizziness and hand tingling. She attributed it to stress or poor sleep. One morning, she couldn't speak clearly for 10 minutes, a TIA. After consulting her doctor, she adjusted her medications and lifestyle, preventing a more severe outcome. Her experience underscores the importance of listening to your body's signals. If you experience morning symptoms like dizziness, weakness, numbness, or slurred speech, take immediate action. Write down the details, what you felt, when it occurred, and how long it lasted. Share this information with your doctor, even if the symptoms disappear. Use a notebook or health app to track patterns, which can help identify underlying issues. If symptoms are severe, such as sudden vision loss, severe headache, or confusion, seek emergency care immediately, as these could indicate a stroke in progress. The brain sends these signals to protect you, but they require your attention.
The Stroke Association emphasizes that early intervention for TIAs can reduce stroke risk by up to 80%. By acting promptly, you're giving yourself the best chance to stay healthy and independent. Habit 6. Mismanaging morning medications. The sixth habit is mismanaging morning medications, a common issue among older adults. Many seniors take pills for blood pressure, cholesterol, or blood thinning, which are essential for protecting the brain against stroke. However, inconsistencies in how or when these medications are taken can reduce their effectiveness or cause harm. Skipping a dose can cause blood pressure to spike, while taking a double dose by mistake can lead to dangerously low pressure or increased bleeding risk. Taking pills with coffee or juice instead of water can also impair absorption. Robert, a 71-year-old on blood thinners, took his pills inconsistently, sometimes with his morning latte or without food. He experienced dizzy spells and bruising, signs his medication wasn't working properly. By using a pill organizer and taking his meds with water at the same time daily, his symptoms improved. To manage medications effectively, use a pill organizer to sort doses by time of day. Set a reminder on your phone or place your pills near a daily habit like brushing your teeth. Take medications with a full glass of water to ensure proper absorption, and never adjust your dose without consulting your doctor. These steps ensure your medications work as intended, protecting your brain from stroke risk. The American Heart Association notes that consistent medication adherence can reduce stroke risk by 25% in patients with cardiovascular conditions. A simple, organized routine can make a significant difference in your brain health.
Habit 7. Delaying morning bathroom trips. The final habit is delaying a morning bathroom trip. Many people wake up with a full bladder, but linger in bed, checking their phone or waiting for coffee before addressing the urge. This habit may seem harmless, but it can stress your body. A full bladder triggers the release of cortisol and adrenaline, hormones that raise blood pressure and constrict blood vessels. In older adults, especially those with high blood pressure or heart conditions, this stress can increase the risk of irregular heart rhythms or clot formation, both of which elevate stroke risk. Margaret, a 69-year-old, often delayed her morning bathroom trip to scroll through her phone. She began experiencing heart palpitations and dizziness. After prioritizing an immediate bathroom visit upon waking, her symptoms decreased significantly. This small change reduced her body's stress response. To protect your brain, go to the bathroom as soon as you feel the urge after waking. This simple act reduces the release of stress hormones and eases pressure on your heart and blood vessels. It requires no special tools or time, just a commitment to listening to your body's needs. Research in the Journal of Cardiology suggests that chronic bladder distension can increase cardiovascular stress by 15%, particularly in older adults with existing heart issues. By addressing your bladder signals promptly, you're supporting both your brain and heart health. Stroke doesn't happen suddenly. It builds through small daily habits that stress your brain's blood vessels. The 7 habits discussed, rushing out of bed, skipping water, eating high-sodium foods, drinking coffee on an empty stomach, ignoring symptoms, mismanaging medications, and delaying bathroom trips, may seem minor, but their cumulative effect can be significant. By making small changes, such as drinking water first thing, choosing low-sodium breakfasts, or taking medications consistently, you can protect your brain, memory, and independence. Start with 1 or 2 changes this week. Write down your chosen habit and commit to trying it tomorrow. These adjustments don't require a complete lifestyle overhaul, just a willingness to prioritize your health. Your brain is an incredible organ, and with these simple steps, you're giving it the care it needs to thrive. Share your experiences and insights with others to build a community of health-conscious seniors. Together, you can make mornings healthier and reduce the risk of stroke for years to come.